Hi everybody, I'm Steve Cook, and normally you would hear, and I'm David DeMuzio, but David is not here with us today. I'm going to try to fill in and do the best job I can, and make sure you stay tuned for Hair Loss Hope and subscribe to that channel on YouTube to find all about hair loss, find out all about how to solve your hair loss issues. Today we're in Dr. McGrath's office in Austin, Texas, and we're really fortunate to have one of Dr. McGrath's patients stop by, Bobby. Welcome, Bobby.
What's up, guys?
So Bobby's about 8 months post-op, and his procedure, which already looks incredible and amazing, and I'm super jealous, is not complete. And you'll be able to see some photos of where he started, okay? But what we're gonna do is we're gonna talk about his experience with Dr. McGrath, and we're gonna talk about where he started and where he potentially will end up. I don't know how much better it can get, but it looks pretty darn good. So let's talk about a few things. So Bobby, how you feeling about your procedure?
I feel great. I feel like a new man, so couldn't ask for anything better.
So your results are what you expected? I know you're hoping for more.
Absolutely. So came to the right place, that's for sure.
Awesome, awesome. So how excited are you? I mean, I think as a patient myself, there's a lot of anxiety, and is this gonna work? I don't want to speak for you, but no, I know that going through the first few months waiting for it to grow makes you kind of anxious. Tell us a little bit about what your feelings were when it first, and then the surgery was complete, you went to one of the top doctors in the world, and then you had to wait for it to grow. How was that process?
Well, after the surgery, I felt relieved. I feel like the main thing, I was like, man, I actually did it, went through it, and I was just, hoping for the best, really. I was like, man, hopefully it grows back the way I wanted to, and looks the way I want as well. So the first couple months it was kind of, nothing's growing, and the new hair kind of like was falling out. So let's keep texting you, and I was like, hey Steve, is this gonna work or what? And then I just kept reassuring me to be patient, and luckily it turned out great, so couldn't be happier.
That's awesome, fantastic. So far so good, and we still have 4 months to go. But let's go back, let's talk about kind of what you were going through as a young guy. You're a fitness guy, you're a bodybuilder, you're a sports athlete, a collegiate athlete, and it is what it is. You're a pretty good looking dude. So what were you emotionally going through? I think a lot of patients out there that are wondering if they should do this or not. Are they gonna try to fix something that's really not broke? How did you feel about your situation with your hair loss prior to making a decision? What were you going through?
Yeah, I was kind of having anxiety about it, to be honest. My dad is bald, and I felt like I was going in that direction, and working in the fitness industry, like your appearance is everything. And also with my fitness channel on YouTube, like I'm like, man, like I can just see the film, and my hair is just looking worse and worse, and I feel like, hey, I just felt insecure about it, and I just need to make a change. So that's what I did.
Oh, I know the feeling. So let me just make sure, because I'm going to rewind my life about 30 years. So basically you walk in the gym, heads are turning, you're in top shape, you're helping others, and when you go over to the dumbbell rack, the only place your eyes go are to the hair, right?
Exactly.
And there's nothing that can make that better. I mean, you could be jacked, you could have 18-inch arms, you can have huge thighs, you can have 6% body fat, you could have all the people looking at you in the gym, and without the hair, am I mistaken, or is it just something that you're not complete?
Oh, you're right. I would always, grow my hair out to cover my receding hairline, and whenever I'm doing like a set or something, I'll look and I'm like, oh, is that right? Can I move this? And I just feel like, people were judging my hair, and I hated that feeling. So
how do you feel now?
Amazing, like a new man. So
awesome. So in your search, so you decide that you need to make a move. There was something about your hair, obviously it's fallen out. And that's not cool. Not in your 20s, not in your 30s, not in your 40s. Trust me, not in your 50s. So tell us a little bit about your search. Where kind of did you hit that kind of rock bottom to where you needed to find someone, or you needed to find something? I'm sure you Google searched, but tell us a little bit about that process of what you went through to finally decide. I know you said your dad had done something with his hair, but he probably was a good help. But tell us kind of what that search was like.
Yeah, so basically, even prior to me losing my hair, when it was getting worse, I was watching David and you talk about hair loss, and then when I was like, man, I got to do something about it. And so when I was searching for hair specialists and stuff, I was looking through some comments for McGrath Hair Medical, and I saw a comment. I was like, man, that guy looks familiar. And I looked on YouTube, it was David's comment, and I'm like, okay, that's legit. Like, I'm going there and made a call to Steve, and the rest is history.
So David and I, when we talk about patients and helping patients, we don't endorse Dr. McGrath specifically. I mean, the guy's a rock star. I mean, obviously you're a great example of that. I mean, it speaks for itself. But what we want patients to do is go through that process, which you went through. I remember when we spoke originally and we started talking about the channel and you were watching us and you really liked David's hair, and I was like, hey, this is as good as it gets and there's no reason why we can't achieve that for you. But your ultimate decision in choosing Dr. McGrath, once you did decide on that, tell us a little bit about your experience and kind of, how the office team helped you. Was there good customer service? How was your procedure day? Walk us through that, because remember, these things are not cheap.
Yeah.
You're taking a risk. Nobody knows for sure what's going to happen. So, let us know kind of what your experience was.
Yeah, of course. So, I called you, we had our consultation, and you told me, it's like, hey, like, get on finasteride and everything and try that out first. But I was like kind of pushy with you. I was like, Steve, man, I need to get the surgery, man. Like, I don't care. I saved up money. I just want to get it done. And so, he convinced me, and, we actually made the surgery pretty quick, within a week. And at first I was like nervous. I was like, man, am I really gonna do this? This is like, 5 or 6 days. Talked to my parents about it. I actually called one of my best friends. I'm like, hey, what do you think of me, like, getting this procedure done? And he was like, hey, it's your body, whatever makes you feel better. And I kind of got that reassurance, and I told you, hey, let's do it. And the kind of rest is history. You kind of just told me, like, hey, if you need to, no drinking alcohol or anything the last couple of days before the surgery. And I came up here, and when I wasn't really nervous or anything, I would say that, but when I was talking to Dr. McGrath, when he drew the new hairline on me, and then I saw like the operating table, then I was like, oh crap, I'm about to do this. There's no turning back now. And then they did the procedure, and yeah, went well.
So you would say that based on all the anxiety that you went through thinking about it, which we all do, whether it's a first date on a blind date or we're going to get married and that's a big commitment. I mean, this is something you might not be able to reverse. So you went through all that. In regards to your surgical day, what was your pain level, scale 1 to 10? 10 being unbelievably painful.
Yeah, I would say I didn't really have that much pain after the surgery. I mean, the next couple of days I was kind of sore in the back of my head where they did the FUT procedure. But with the pain medication, it really wasn't terrible. And after like 4 or 5 days, I was back to normal, or at least I felt that way.
So Bobby is an example of, someone that did not have significant hair loss. He's bright enough that, and his dad's experience, where he knew that the writing was on the wall. He's looking at his dad who lost his hair, started losing it about the same age, and he reaches out to a professional. Didn't have to be me, didn't have to be McGrath Medical. What kind of advice are you going to get? Are you going to just be rushed into surgery, or are you going to talk about the preventative treatments? So what Dr. McGrath's team does really well, in my opinion, and David could attest to that as well, and Bobby, is we want to talk about, preventatives versus restoration. So it's preservation versus restoration. In your case, I don't know if you're aware of this or if you remember, because you're so excited now with your new head of hair, but we're not big fans of doing surgery on 20-some-odd-year-old patients if they're not going to at least give the preventative treatment some opportunity to help them from becoming a bald guy. I mean, think about it. If we do 2,000 grafts or 2,500 grafts in the frontal hairline and turn you into really what's probably one of the better heads of hair I've ever seen in my life at this point, and you had a transplant, what happens when the rest of that hair falls out? So we talk about this on Hair Loss Hope over and over and over, but preservation is actually more important than restoration. And I give you credit, you were like, just listen, tell me what I need to do, and you got it, because I want this done, correct?
Yes, sir.
What are your friends saying? What are your, guys in the gym? Is anybody in the gym walking up to you like, dude, like, did you see something different? Like, what's going on? How about your dating? I know you're not a married guy, so you must have a lot of women. Tell us about, what your dad, who also helped you through this, give us an idea of what your friends and family are saying.
They love it. My friends and my mom especially, she was like, man, it looks so much thicker and everything, and just all good things, like nothing bad. Like people are always like, man, your hair looks so much thicker, and it just looks so much better, and it just gives me that confidence. So.
I had a patient like yourself that was starting off on first base and was talking to me, and he said, I really need to talk to somebody because I didn't even know I was losing my hair till one of my friends said, oh, you got a bald spot in the back. I'm like, nice friend.
Yeah, that's what my friend did too. He told me I was losing it because he was already going bald.
That's the ones that notice are the ones that are losing their hair. So it's really cool, and coming from a patient standpoint as well, that when you really hit a home run after just even one procedure, that going back and, you're not kind of flexing your muscles, just saying, listen, man, I took care of what I had to take care of, right? So
yeah.
That's how you feel.
Yeah, and it's funny you say that because I actually saw my friend. He told me I was going bald last week, and I was telling his girlfriend, oh, hey, how do you like my hair? And she's like, oh, it looks so much better. Hey, Kendall, why don't you, maybe you should go look into that too. So, it works. So.
Very cool, very cool. So Bobby, what's really exciting to me is I see all different kinds of people. I mean, there's male, female, there's all different races, there's any age. I mean, one of my favorite sayings is hair loss does not discriminate. Believe me, there's no discrimination when it comes to hair loss. Kind of like going to the gym and you're seeing all different kinds of people. You got to give them a lot of credit walking through those doors. So I'm real excited because I know you're an online influencer for fitness. Obviously, you're in great shape. And just maybe touch on what this has done for you from a professional standpoint. Did you feel, I don't want to put words in your mouth, that without this, you really couldn't go down this path of being this, image-based career kind of person out there in the world?
Yeah, I feel like it's definitely made a big difference. Like seeing myself on camera before the surgery, I was like, man, like my hairline, like I wear a hat or something to cover it up because I didn't feel, comfortable filming. And as a personal trainer, like your appearance is everything, and so the main thing is looking good. You look the part, and I felt like my hair was missing. So now I feel like I'm able to get more people and get more people to watch my channel because of that.
So Bobby, here we are, kind of wrapping everything up, and I just, of course, have to ask you, would you recommend Dr. McGrath and McGrath Medical to anyone out there suffering from hair loss?
Absolutely, 100%. So the results speak for themselves.
Very cool, very cool. Okay, so Bobby, congratulations.
Appreciate it.
You look fantastic. Again, just another guy like David that I got to be jealous of, but in a good way. And I want to thank everyone for watching, and please subscribe to Hair Loss Hope, where we can help you find some answers to your hair loss.